Hello, and welcome to the latest session of the Global Health Network's Epidemic Ethics Seminars. This session is being recorded and will be available from later this week on the Epidemic Ethics website. I'm Helen Branswell. I'm a reporter with STAT, which is a Boston-based health and science news website where I cover infectious diseases and global health. I've been covering infectious diseases since the SARS outbreak of 2003, and spent a lot of time in the first decade of this century writing about H5N1 bird flu, which leads me to today's topic, which is a very timely one: avian influenza, ethical preparedness. As you will have seen in the news, fear has been mounting in the world that the world could be facing a flu pandemic caused by the dangerous H5N1 avian flu virus, which is currently spreading in unprecedented ways around the globe. We'll hear a little bit about that in a few minutes. Wild birds and domestic poultry have died in huge numbers, but the virus is also infecting and killing a range of mammals: foxes, farmed mink, seals, even bears. In an outbreak among farmed mink in Spain last fall, it appeared that the virus may have been spreading from mink to mink, which raises questions about mammalian adaptation. This seminar will explore the distinctive ethical questions and considerations raised by an avian influenza pandemic and discuss priorities for ethical preparedness. The questions before us include what lessons can be learned from prior experiences with bird flu viruses and pandemic flu preparedness in general. How should our experiences with COVID-19 inform our preparations for a bird flu pandemic? And what should society prioritize to better ensure responses to a possible bird flu pandemic are ethically appropriate and fully justified? The way this will work is as follows. Our three panelists, who I'll introduce in a second, will each make short opening remarks. Then we'll proceed into a question and answer period. I've got some questions, but I hope you do as well. If you do, please put them in the Q&A. You can use the chat section to say hello to one another, but I will not be looking there for questions. You can upvote questions you like in the Q&A, which may increase the chance that I'll get to them. We have until the top of the hour for this discussion, and I'll try to get to as many questions as possible. Our panelists today are Dr. Ngo Thi Hoa, who is a molecular microbiologist with the Oxford University Clinical Research Center or unit in Ho Chi Minh City, Vietnam, where she heads the zoonosis group. She is also affiliated with Oxford Center for Tropical Medicine and Global Health, and she is on the faculty of Pham Ngoc Thach University of Medicine, Vietnam. She's a visiting lecturer at the City of Science and Open University in Ho Chi Minh City, and she studies the genetic and microbiological resistance of zoonotic pathogens and the burden of zoonotic infections for potential interventions for the prevention and reduction of zoonotic transmissions and infections. Our second speaker is Lyle Fearnley, who is an associate professor of anthropology at Singapore University of Technology and Design. Trained as an anthropologist of science and medicine, Professor Fearnley received a joint PhD in medical anthropology from the University of California, Berkeley, and San Francisco. His book, Virulent Zones: Animal Disease and Global Health at China's Pandemic Epicenter, was an honorable mention for the 2021 Francis L.K. Hsu Book Prize. In 2021, Lyle was also a finalist for the Falling Walls Science Breakthrough of the Year, based on research discussed in Virulent Zones. Our third panelist is Professor Ross Upshur, who is currently the head of the Division of Clinical Public Health at the Dalla Lana School of Public Health at the University of Toronto. He's also the scientific director of the Bridgepoint Collaboratory for Research and Innovation and assistant director of the Lunenfeld Tannenbaum Research Institute, which is part of Toronto's Sinai Health System. He's also an affiliate member of the Institute for the History and Philosophy of Science and Technology and an adjunct senior scientist at the Institute for Clinical Evaluative Sciences. His research focuses on the intersection of primary care and public health, and his current interests include managing complex chronic health, clinical measurement, the concept of evidence in healthcare, and philosophy of medicine, including the integration of ethics and clinical reasoning. So let's start with Hoa, who's going to give us a bit of a picture of H5N1 and what it is doing now, and particularly how it is affecting farmers in parts of Asia. Over to you, Hoa.
Thank you, everyone. It's nice to see all of you. And I would like to brief you about the H5N1 outbreaks in the global, and then bring some facts of Vietnam situation as well. So the H5N1 virus is part of from the Octomycoviridae families. Is a single-stranded RNA virus with which we can commonly hear about, like influenza A, influenza B family as well. And the virus is first detected in southern China and Hong Kong in 1996. It kills high proportion of poultry, and that's why it's called a high pathogenic avian influenza as well. And then in 1997, the outbreaks of avian influenza in humans had been reported in Hong Kong. Is involved 18 human cases, and 6 of them were died. The clinical manifestation will form asymptomatic to mild respiratory infections and severe pneumonia, and some are having multiple organ failures. Age of the patient are ranging from 1 to 60 years old, over 60 years old, so quite a range, male and female included. And they found that chicken exposure is a risk factor for those. And case in human had been reported in 2003, 4, and until now. But it just look at the last years in 2022 and 2023, we have 10 human cases. Some are asymptomatic, some are mild, but they're severe cases as well. So up to date, we have, like, since 2003 to now, we have about 983 human cases infected and reported in 21 countries. The mortality rate is about 50%, unfortunately, and many cases, or most of the cases, reported in Asia and Middle East countries with outbreaks. The common outbreaks response is commonly by calling the infected birds, infected flocks, and including their infected flock, surrounding flocks as well. So all the surrounding flock will be infected as well, and that led to a large number of poultry have been since 2005 until 2021. It had been quantified with the number, say, 316 million birds being called, and also including wild birds as well. And as Helen mentioned earlier, sporadic cases of H5N1 detection in mammalian animals have been reported via bear, fox, leopard, sea lion, raccoons, minks, etc. There is no human-to-human case transmission so far, and also even though there is a concern that it could be a mammalian case transmission, but as a report from CDC, there is no substitution or mutation on genetic of the virus that lead to understanding of mammalian adaptation yet. But more need to be studied, and that could, we can't say no to it because we don't know if more cases occurs. There might be that be a concern. So what happened in Vietnam? So in Vietnam itself have 218 human cases, with one case occur in 2021, which and 217 cases occur between 2004 to 2014. So for the last 8 years, we have only single cases. It's in recover one. Mortality rate is 50% almost. In Vietnam, 65 millions of poultry have been closed, and most occur in the backyard, small farm, and mostly occur during the Tet holiday, which is like Christmas for the Western country, where the farmer raise a lot of chicken, hopefully to sell for Tet, because that's the like a 3-4 days holiday, and we spend a lot of money on food, and then they can make a large income for the farmer. Unfortunately, it's happened around that time, and then the farmer lost a lot. The response again, a ring fence vaccination surrounding the infected flocks. If human case detected, then they will trace back to the chicken exposed, and then that farm will be identified, and then there is a quarantine strategies that no in out in for the chicken in out in that area as well, and that affect a lot of farmer livelihood as well. And I would like to end it there, and looking forward to discuss with you guys later. Thank you.
Thank you so much. Lyle, over to you. Give us your framing remarks, if you would, please.
Okay, very nice to see everybody. So my background is a medical anthropologist. So it's basically means that I study some of the kind of cultural and social conditions around health. And my research has focused on, initially focused on the avian influenza control programs in South China. And actually some of the issues are quite similar, I think, to what I was just describing for Vietnam. And so I want to highlight just a few things very briefly that I think from the experience of avian influenza over the past decade. So my research basically started in 2008, 2009. Some of the experiences during that period that maybe are useful, and as well as what we've learned from the COVID response. So first of all, I think as you could hear from Hua's introduction, the anticipation of the next pandemic is a very powerful motivation for biosecurity interventions. And so, there's many viruses that are circulating in the world, and there's many viruses circulating in animals and in livestock. But those ones that are considered to have pandemic potential are, of course, the ones that are the most concerning and generate the most kind of severe biosecurity interventions, whether those are culling of animals, market closures, trade bans. And these are interventions that cause death, injury to animals, as well as economic loss and to farmers. And so for thinking about some of the ethical preparedness for how we deal with something that's being identified as having a pandemic potential, we really need to think carefully about these kind of justifications for intervention, and to what extent that justification is justified, and where the limits need to be placed on it. The second thing that I want to point out is that a huge part of the global health response to avian influenza over the past decades has been based around the idea of identifying the origins of the pandemic. And that's why a lot of attention was given to China and Asia more generally. I think at this point, at least with H5N1, we're probably beyond that. And I think it's interesting to reflect on that issue about what happens when we're beyond the effort to identify an origin and contain that origin, and what other issues come up when the virus has already circulated so widely globally across many species. The third point is that I think many of us in elite global health institutions tend to identify practices as high risk for zoonotic transmission that are unfamiliar or considered maybe non-modern to us, such as things like smallholder farming, or so-called backyard poultry farming, or live poultry markets, while paying maybe less attention to risks that could be associated with more familiar modernized practices, whether those could be like industrial broiler farms. So I think another maybe interesting ethical and epistemological question is, how do we sort of overcome these kind of epistemological obstacles that we may have in our own knowledge in the way that we assess avian influenza risks and recommend different kinds of interventions. And on that note, I want to particularly talk as an anthropologist about the importance of understanding and accounting for cultural difference when we're implementing responses to pandemic threats. As mentioned above, practices such as live poultry markets that are maybe unfamiliar and strange from certain cultural perspectives may be identified as risky in a way that maybe over-evaluates the risk of those and leads to certain kinds of interventions. At the same time, I want to also complicate the notion of culture that I'm using. So I think often culture is used in a way that is associated with like maybe a repository of moral or aesthetic values that are opposed to scientific or medical reasoning. So we might have to, like, maybe people would say, like, we need to balance the medical justification against the cultural value of something like live poultry markets. But I think instead, I would like to argue that we need to understand cultural difference also to include alternative idioms or forms of scientific and medical reasoning itself. So for example, in my research that I'm currently doing on live poultry markets in South China, what I'm finding and I'm trying to show about these results is that so typically we think about live poultry markets maybe as a traditional practice, and so maybe it should be justified in terms of its cultural traditional value, even though it's risky, right? But if you ask shoppers at live poultry markets in South China why they prefer to buy live poultry, it's not only about some sort of like traditional values of freshness or cultural values, but it's actually also a lot about safety and about risk to their own health. And basically an understanding that the live poultry enabled them to evaluate the health of the poultry in a way that's not possible in buying pre-processed, pre-butchered supermarket meat that's in a chiller. So rather than just thinking about it as kind of medical against cultural, we should try to think about how this itself might be a kind of alternative cultural idiom, medical idiom. Thanks.
Well, that was fascinating. I have to say, I never thought about wet markets in quite that way. That's a really interesting point to make. I'm going to turn this over to Ross next, but I'm also going to prompt you, people who are on the call, to please start putting questions into the Q&A. I'm not seeing any at this point, and we're going to get to that part of the discussion soon. So in the meantime, Ross, please.
Great.
Give us your thoughts.
Thanks, Helen. It's a real honor and privilege to be here today. And I'm really delighted, Helen, to have you. It's a privilege also to have you as our moderator. And I can't think of anybody who knows more about this landscape than you. And I hope you will chime in with your perspectives. And I think it's also wonderful to have a molecular biology and an anthropology perspective to this as well. So I'm going to take a slightly longer view, having entered into public health in the early 90s, right around the time when the emerging infectious disease report came out by the Institute of Medicine, which was kind of a blueprint for everything that we have experienced in a multiplicity of different outbreaks over the past 30 years. So I was involved in all of them, including SARS-1 here in Toronto. So there's a bit of a back to the future deja vu all over again, where a coronavirus outbreak, in the case of SARS-1, it hit, I think it was in Vietnam, Hong Kong, and Toronto was the biggest center outside of Southeast Asia afflicted by it. And I was seconded to public health to work on this, and that's how I got involved in the ethics side, because in the 90s, you couldn't get anybody to take viruses seriously. Everybody was interested in bacteria. I was trying to start a career as a viral epidemiologist, and there's just no takers. Everybody go, oh, it's just a virus, and my thesis was more than just the flu. So after SARS-1, people started to get, it was around 2005 that H5N1 became the next pandemic potential, and influenza viruses. So if you study influenza or you study viruses, you learn two things. One, how little we actually know about them, two, how varied and fascinating they are as a life form. And we need to, as I've said on 1,000 times, respect the virus. So there are a multiplicity of different types of, influenza viruses out there. There's 18 hemagglutinins and 11 neuraminidase, and there's already 14 or 15 different subtypes that have shown capacity to be involved with humans. So here we are again, 20 years later, where we have a large coronavirus outbreak, very soon followed by a concern for a new recrudescence of H5N1. So what are the ethical issues? Well, they're very big and very small. The very big ones are, who are we as humans? How do we interact with our environments? Why is it we have, I use in one of my classes a graph of the sort of exponential growth of chickens and chicken consumption, and ask the question, just how many, fried bits of chicken do we need to sustain ourselves as a species on this planet? And it's just one example. And I think we would be foolish to focus strictly on H5N1 and get particular about this. We need to step back. And I think that with this new pandemic treaty, there's an opportunity for us to reflect more deeply on, and that's why I think, anthropology and molecular biology are so critical to this. One, we need surveillance to understand what's going on in the microbial world. And we need a much more nuanced, Lyle, you had a beautiful turn of phrase about idioms and epistemologies. We need to understand ourselves better, because we're actually, to quote an old Pogo cartoon, I've seen the enemy and he is us. We are the responsible agents for the conditions that drive infectious disease outbreaks and pandemics in the manifold ways in which we behave in economics and personal behavior. If you've ever, for things like monkeypox or mpox, pardon me, and other infections. So yes, on a very big level, infectious diseases pose a multitude of ethical questions that are very simple and very complex simultaneously. So coming to terms with this means that we need to really have a concerted transdisciplinary approach to how we're going to think about these things and respond to them. And I think that the currently negotiated pandemic treaty in its zero draft is our opportunity to finally grapple with all of these manifold issues. And so to each and every person on this call, I recommend that you read that treaty carefully. It's in its zero draft, and that it's still open for comments and suggestions. And if we're going to take seriously the threat that viruses pose to human health, and it's just one of many, we've also got antimicrobial. It's not just the virus. Now everybody's alert to the virus, but it's not just the virus. We've got bacteria. We've got lots of microbial threats out there. But this is our opportunity to actually build systems that respond and actually may provide some safety for humans and an effective response. And I'll stop there for the time being. Thank you, and over.
Okay. Thanks very much. And we've gotten a couple of questions. I appreciate that. Please add more. I'm going to start with one that, was inspired by Hua's remarks and also Lyle's. I'm wondering, in the West, the issue is typically with bird flus, it's industrial farming. But in Southeast Asia, for instance, North Africa, which has had problems with H5 in the past, it is much more of an issue of small holdings, backyard farms. People are much closer to their chickens. And as Lyle was talking about, much more used to buying chicken that is absolutely fresh in live markets that frankly allow viruses to spread to people, if there are viruses present. I guess I'm wondering from the two of you, what is owed to the farmers in those cases? I mean, how do we address pandemic concerns without inflicting economic hardship on people for whom this is, an integral part of their livelihood. And I guess, Lyle, I would also ask, is there any willingness to reconsider the live poultry market situation? Is it fair to even ask that in those settings?
I'll just quickly say something about farmers, and then I'm going to let talk more about that part of it. But I was just going to say one quick thing about farmers is that I found in my own research in China is this one thing that's probably is the opposition between industrial and sort of backyard that we might imagine. Like I'm also from New England, so we have like industrial farms, and then we have some people in their yards or their pretty their plot of land, they might have a house with some chickens. But actually in China, with the kind of growth in poultry farming that grew out of from the 1970s to now, just massive expansion within China, it's much more blurred in between those boundaries. So there's a lot of contract farming where it's a sort of single farm household, but they have 1,000 to 2,000, or then there's some that have 10,000 chickens. And so there's all these different scales that makes it complicated in terms of evaluating the smallholder versus the industrial in terms of practices and things like that. And in terms of, so I'll just, that's my comment about that. In terms of the live poultry markets, I mean, in China right now, the policy trend is towards outlawing them. But I'm interested in, whether that's the only approach. So we know there's risks associated with live poultry farming, but I would, there may be ways. What I'm trying to show is that there's some value that people have in these markets that actually is about health and safety as well. So, is there a way that those could be maybe reformed and made into a hygienic practice? And one that doesn't have some of the zoonotic transmission risks, with that, while also retaining some of the values that people have. And there's several reasons why that would be the case. One is the values that I'm talking about. Second is when we outlaw them, maybe unanticipated negative practices also occur, such as black markets or illegal trade, which are even maybe more risky in a sense. And then a third aspect is that what are some of the other risks that might be produced out of this process, whether it's to sort of industrialize farming that also is not being done in a biosecure fashion either, but is benefits from the kind of the slaughterhouse regime and supermarket slaughterhouse to large scale industrial farms. But if that also maybe has biosecurity risks, are we anticipating that? Are we recognizing that when we're calling for this transition? So, and one final thing is, if we look at Hong Kong, they have actually produced, a regulated form of live poultry market without outlawing them. So there may be some opportunities to look at that as well.
Great question, Helen. So when we're thinking about balancing interests of different populations, so smallholding farmer, people have this bucolic notion of chickens free range, but as Lyle mentioned, if you've ever visited an industrial scale poultry farm, you will have a very different view of things. And of course, it's been, not very pleasant for the species of chickens themselves. If you think about how through evolution, how chickens over, vast periods of time had adapted to ecology, then they became domesticated. And now, not to be a pure animal liberationist, like almost entirely enslaved. And again, back to the H5N1 concerns in the early 2000s, there was massive culling of poultry populations. And I'm talking about the incineration of millions of poultry. And also, I think it was in Indonesia, if someone can correct me if I'm wrong, that they were doing this, they were culling small holding farms. So my dark humor at the time was that if they kept culling chickens at the rate that they were culling them, there wouldn't be enough eggs to propagate influenza vaccine, because it's based out of an egg medium. So we have to think about the all things considered harms and benefits. And if we're going to truly move to a One Health view of things, which is in the new pandemic treaty, then we're going to have to start asking some very difficult questions about the interests of non-human species and our treatment of them. I'm not sure what the easy answer is to those questions. Another strain of research I was involved in early in my career was around environmental ethics and asking questions about the status of not just non-human organisms, but ecosystems themselves. And again, back to I've seen the enemy and he is us, human productive extractive behavior tends to take a very heavy toll on ecosystems. And we're seeing two manifestations of that. And we cannot separate what we're seeing in terms of viral emergence and reemergence and pandemics from the same sort of human economic interactions with the ecology that are driving problems in climate change. They're two related crises, and handling one doesn't solve the other. And we kind of have, again, this was one of my complaints when I was in public health training. We split apart environmental health from communicable diseases. And a lot of the work that I was trying to get off the ground in the late 90s was trying to find a way to bring them back together. One Health is trying to do that, but it has a particular focus on zoonoses. And zoonoses are only one part of the great set of challenges that we are facing as a species. Now, I'm not sure how helpful that answer was, but it was sure nice to get it off my chest. Thanks, and over.
Wow.
Helen, I think that Lyle and Rush cover most of it. I'm just trying to think. So I work with the farmer myself, and I work with smallholder most of the time because we, due to biosecurity reason, the scientists or other people quite difficult to get into the industrial farm. And I think that was one of the advantage for the industrial farm, that they have a better biosecurity. And for the smallholder, they have a lower level of that. Also, for the management of smallholder, a smallholder in Vietnam, for example, is the sub-department of animal health would not know exactly how many smallholder, because some of them are too small to be reported, too small under the certain level to be registered. And also sometimes they don't report the full number of animals in the farm, for example. So this is a challenge for the local authority to deal with biosecurity in the smallholder as well. The other challenge I felt is that for smallholder, because of having small, they are poor farmer, and for 6 animals, instead of comply to the biosecurity, they may not do, and they either consume themselves, they sell to the market, they do something that we don't know and we did not know, and that may lead to the problem of why this happened more in the smallholder than the other. But what can we do? Vietnam had a policy to move the farm into the corn farming area. And like if you go to the large farm, you should go to the farming area and then you rent a plot of land and to develop your farm. But not everyone can afford that. And that causes an issue as well. And a problem if I have a small plot of land for gardening, and if I have a 50 chicken free range, declare that it's self-sustained for family use, and no one can move that away. There is other, I think Rush mentioned, and Lyle also mentioned, that it's a local species of chicken, for example. It cannot be reared in the industrial way. So it had to be free range, it had to be on the ground, had to be jumping around on the tree and things like that. And that also an issue of biosecurity. And it's not easy to solve. Now, you have a question about whether the live market should be back to normal. I guess in Vietnam, they shut down live bird market for a long time. On my way to work every day, I see a live bird market on the street. There is a custom in Vietnam, or that they need a live birth. For example, if the family have a funeral, we need a live bird as a tradition practice, that we need a live bird to the graveyard and things like that for praying and things like that. So it still maintain that. My grandmother is she not alive anymore. She died. She passed away, but she is a chicken seller herself, and she taught us how to look at the chicken and say this is healthy one or not before she buy it and sell to the other. Bought it and can sell to the other. See what I mean? So I agree with Liz about people want to look at the chicken and wanted to see, yes, this is a healthy one, this is safe to eat, and then they buy it instead of buying from a supermarket and trust that other people make a judgment on it. So they still maintain a fresh chicken consumption in Vietnam at certain level.
Great, thanks to the three of you. We do have some questions, and I'm going to just throw some out fairly quickly. I probably don't need everybody to respond. For instance, on this one, I think probably one person would do. Can anyone guess the timing of the transition of effective transmission of highly pathogenic avian influenza between people? So do we have any idea? I would inject whether if this is going to happen, and if it's going to happen, when it's going to happen. Quick answer.
No idea.
That's pretty quick. No arguments from the other two, I take it. Somebody asked, how is preparedness for avian influenza different from other infectious diseases? I mean, when you're talking about pandemic preparedness, certainly for, you know, in the aughts and in the teens, we would have been talking about, generally speaking, flu, but coronaviruses have really made us rethink how broadly we need to be thinking about infectious disease outbreaks. And not everything is a pandemic. I mean, there are places that have bad outbreaks of really bad diseases that are zoonotic. Is there a difference in preparedness?
So I'll just quickly chime in. Our general framing of preparedness has been for respiratory pathogens primarily. And so for respiratory viruses, largely because their mode of transmission favors rapid dissemination globally, unlike, you know, viruses like Ebola or Mpox. So the mode of transmission, I think, has heavily flavored our way of thinking about preparedness, because the greatest potential for global spread comes primarily from respiratory pathogens, of which there are a large number, and we need to remember that's why getting focused exclusively on influenza is a mistake. There's, you know, and that's what coronavirus reminded us of, and there are other respiratory pathogens, and then there's the whole uncharacterized, unknown, yet to show their face viruses. So I think that's one of the major points. Over. Anybody
else want to jump in? Any thoughts about differences?
Just quickly, I would say that one big difference is between pathogens that are already introduced into livestock or domestic animal populations versus pathogens that are still only in wildlife reservoirs. And so you could see that difference with COVID, probably, unless it was in livestock, but probably COVID was jumping pretty recently from a wildlife reservoir, whereas these influenza viruses like H5N1 has been in domestic population, poultry population since the 1990s, right, at least. And so then that means the whole, you know, how we think about containment is quite different. Like all these issues we're talking about the, you know, livestock industry is not so relevant necessarily for some pathogens that are still in wildlife reservoirs.
Right. Let's see, what else do we have here? Somebody asks about ethical dilemmas that are at play with regard to public disclosure of human-to-human transmission. Wanting to know who has the privilege to know. I mean, I can start there by pointing out that under the international health regulations, there is a requirement on any country that observes human-to-human transmission of a non-human pathogen to report to the WHO in a very prompt period of time. I think within 24 hours of recognizing that that's underway. I'm not certain that I think there's a high degree of impetus to be absolutely certain that that's what you're dealing with. I think it's ringing those bells, or it's a very difficult decision to make. But Lyle, Ross, Wad, any thoughts about who has the right to know and how quickly we would expect to know?
So yeah, you are correct. The person, the group, I mean, it depends on the strength of public health system. So you're right, we have all member states, and of course this presumes that the new virus emerges in a member state that's part of the World Health Organization, that's bound by the international health regulations, that's actually got its system up in compliance with the international health regulations, which we know not all member states are. Then the question becomes one of communication, and I think this raises huge ethical issues, as we've seen and experienced. The one really novel development of the COVID-19 pandemic has been the extent of misinformation and the rapidity with which misinformation can spread and be used for a multitude of purposes. So it would be public health authorities would have the right to that information, but how they communicate to the public. We went through this again in SARS-1, and it was part of our initial framework for ethical issues in pandemics about, naming names. So for example, in Toronto, there was a case of somebody who was on a public transit who was found to be a case of SARS, and people were clamoring to know who that person was, and had this arguments were being made that the public had a right to know the identity of this individual, which is of course complete nonsense. So you have to maintain privacy protections, so you can divulge certain aspects of information, and there's good ethical and legal reasons for doing that. But actually, giving the name and the address of the person who had the infection, I think, is not necessarily within the scope of acceptable communication. And that's going to require judgment. And we need to train our public health authorities on good communication practices. Over.
Anybody else want to jump in on that one? Okay. Let's see. Another question is, it actually touches on something Ross raised in his opening remarks. Is pandemic preparedness too human-centric? Is the way we're approaching, thinking about preparing for pandemics hindered by the fact that we're thinking about it in terms of humans effectively only, as opposed to the One Health approach, and that takes into consideration issues like climate change and food security and all those other things? Are we getting in our own way effectively because we're only focusing on people? Lyle, thoughts?
Hand in that direction by arguing that we need to take seriously the interests not just of humans, but of non-human animals, and also ecosystems themselves, so watersheds, forests. And that's why I said, the ethical issues are very big and very complex, but also very simple and very local. And how we mediate between these demands is the challenge that we face as a species if we wish to have any chance of long-term survival. Because if we continue on our current course of increasing despoilation and destruction of natural habitats with all of there's another report that came out that showed the collapse of species and higher extinction rates. If we continue along this course, and we now know we have credible evidence from multiple different sciences. It doesn't take a genius to figure out that there are very important issues that need to be sorted out. But there's no, it's just there's nobody in charge, so to speak, that's going to say, hey, maybe we ought to stop doing this for a little while, and maybe we ought to try a different approach, both socially, culturally, and economically. I'll leave it to Lyle and Ngo to speak to this, because changing human behavior is by no means simple. As I've been a clinician for 35 years, as well as a public health physician. Telling people to stop smoking and drinking because it's harming them is not a terribly effective intervention. They'll look at you, go, yep, and on a collective level, consuming large amounts of animals and destroying more and more ecosystems in order to create more animals is likely not going to be good in the long run. But
very quickly, just to say, that analogy to smoking and drinking is actually very interesting. I think maybe should be talked about more in this context, because yeah, we know that consuming lots of animal products is leading to huge increases in the number of animals on the planet, which no doubt is creating more risks for zoonotic disease just by population size alone, right? And yet, so in different moments, people call for reducing consumption of meat. It's in a lot of reports and things like that. But if you can see, if the track record for things like smoking is so difficult, it's worth thinking that through, how we would then approach that as a behavior change, I think is interesting.
Great, thanks very much. There's another question here about culling of birds. And this is a bit afield from ethics particularly, but it's kind of an interesting one. Is there any evidence that total culling of flocks has been effective? What?
Yes, I think there is. I can't give a very scientific evidence, but for example, in Vietnam, we know that if we don't cull the flocks, the movement of any infected animal keep going on, and then there will be a spread. It has been shown that the culling is the sooner you do it, the better, and then the rest, the remaining, the outer space of that infected flock should be vaccinated as well. To be honest, we have published a paper. We suggest that actually the vaccination, ring-fence vaccination, if we don't do it properly, that would be worse than to spread the virus, because you go from infected area and you move it outward. And if we don't have PPE, proper disinfectant, the vehicle could be human vehicle, anything from infected area can be moved out to the less infection area as well. But so far in Vietnam, I don't know about the world, but I know in Vietnam, culling the animals help. It's not just avian influenza. We're talking about, for example, blue ear disease in pigs as well. So that's required, because the treatment, we can't treat the viral infection in animal effectively right now. That's what we help so much, and it's also preventing the transmission from one flock to the other as well, not just to human cases, but onto the animal population to protect the rest of the animal population. So the farmer who not in the infected area love to know that that area has been treated and cooled, and that they feel safe for themselves. Otherwise, they give vaccine, no, not vaccine, but they give antibiotic for the animal, knowing that the outbreak is the virus. But they want to prevent any secondary infection from bacterial infection to their flock.
Great, thank you. Another question. Do you think governments have learned enough from the COVID-19 pandemic so that they will react more ethically in the next pandemic? Any thoughts?
It'll be a different government, and so we're going to have to reinvent it all again. So it's the institutional learning. I think this is where we need to embed our responses in strong structures and in strong institutions as much as we can, because governments come and go. And we need to, and I would say it's actually on the policy level, depending on where you live, it's the enduring institutions are the ministries and the people working in the different ministries, and civil society organizations that hold governments to account. So I think we need to, I'm skeptical that they actually have learned enough, but I'm not sure what sort of vaccine we have for the future to make sure that we don't do the same thing over again. Over.
Anybody else have thoughts about whether governments have learned the right lessons in the last 3 years?
I don't know about other countries, but I felt in Vietnam we learned a great lesson. But if comparing the COVID pandemic to the avian influenza is totally not fair. One, we have infected human and it transmits quickly, and we have free vaccine for everyone in Vietnam. For example, it may come late, but it's available free, and then people take it. While avian influenza, it infected the birds most of the time. And human case come, yes, there is an outbreak with 100 people in Vietnam before, but then lately, with the better control in animal infection and outbreaks, then we reduce the number of human cases as we see by time. The thing is, for me, is that the vaccination of birds for avian influenza is the farmer pay for it. At the outbreak, I think it's the government funded, the local authority funded vaccine for the bird around. That's what I know. But if we have a free vaccine for animal, yes, that would be helpful. But whether we can afford that, to be honest, I felt the farmer, they don't do the, for example, avian influenza vaccination is one of the compulsory vaccine for chicken for a while in Vietnam, and now today it's also pushing for that as well. But we're not sure it's 100% of the bird would be vaccinated. Whether it's 80%, 70% of bird is vaccinated, we don't know. But working with the sub-department animal health in Vietnam, for example, I know the big flocks of chicken, for example, if we want to move from a province to the other province with a better market price, they must have certificate of avian influenza vaccination, for example, including other vaccine as well. But the farmer, that's it at the farmer cost and the money, so it's different. To be honest, I talked to, so avian influenza endemic or outbreak response was a problem for the farmer themselves, because they felt that human cases like human-centric issue, human infected, my bird got killed and things like that, they felt. And they said that they've been farmer for many years, they eat sick chicken, they don't get sick. So other people, they don't rearing the animal, they got sick themselves, why is kill my chicken? But we guess that after the COVID, people have been learning that vaccination and quarantine and things like that actually helpful for preventing the outbreak to spread. And we guess we just talked last week. We say maybe if we go back to ask them about H5N1, maybe Lee can do this about their response to the quarantine of the H5N1 and things like that. There might be a different response. They might feel the effectiveness of that after the COVID lesson.
Great, thanks very much. Another question about how much active surveillance there is in other parts of the world. I mean, Southeast Asia has been dealing, or South Asia in particular, has been dealing with avian influenza for quite some time. And as I mentioned earlier, Egypt had a huge problem in the teens. But I mean, how good a job are we doing looking for it in other parts of Africa, in South America? How good is surveillance at this point?
The answer to that question is not as good as it could be. And I think if there's one thing that coming out of, again, a positive thing coming out of COVID-19 has been the capacity for sequencing to inform public health response. So I think that's real. On the negative side was the misinformation. On the positive side was finally harnessing the genomics revolution for a really beneficial public health purpose. So I think we need to set up global surveillance systems, and I think there's efforts to piggyback on the back of the global influenza surveillance networks that are existing, but those need to be bolstered, strengthened, and we need to have sequencing capacity across the board around the world, because that's something that I think can really help us moving forward.
We're getting near the end of our time. I'm going to ask quickly, one of our attendees is asking, is there an ethical framework already in place for a flu pandemic? I would imagine that would be something WHO related.
Yeah, we did one.
Might have some...
So again, back to the future again. After SARS, we published our group in Toronto a framework. That framework then was picked up by the WHO. They published a framework for ethical issues in pandemics. It's still a pretty good document. I think we need to go back and revisit some of it, but the key issues that are identified, I think, are still germane. We need to amplify it a little bit with some of the things we've been talking about today here with One Health and human animal and human ecosystem ethics. Over.
And I'm going to sneak this one in because it's related. Are we ready on sort of the research ethics front to deal with another pandemic? Did we learn enough in the last with COVID about what didn't work and what does work, that we can adapt plans and be ready to do the kinds of rapid fire research that will need to be done, but need to be done ethically?
Yes, I think so here's the thing, having co-chaired the WHO COVID ethics working group for the last 3 years, we went very confident in February 2020 that we have our act together in terms of ethics, but nobody paid attention. We have a knowledge translation issue. So research ethics is robust, but a study that we just completed showed that with all the billions of dollars that went into research during COVID, precious few resources were given to REBs in order to expand their efforts to deal with the massive number of protocols that were coming their way. Yet we still heard the same complaints from investigators about REBs blocking things. It doesn't have to be that way. It wasn't that way in Ebola. So we have to think of a research ecosystem that requires resourcing, and ethics review is a critical component of that. And it requires a resourcing training as much as any other component.
Great, thanks. I think I'm going to have to leave it there because we just about are out of time. I want to say thank you so very much to our 3 panelists for bringing such interesting ideas to share with us. And thank you all in the audience for attending and for submitting your questions. As I mentioned at the start, this session is being recorded and will be available later this week on the Epidemic Ethics seminar page, where you can also find information about upcoming events in this series. You can also follow this work on Twitter, LinkedIn, and Instagram. Thanks again, and have a good rest of your day.
And thanks, Helen, for your wonderful moderating. Greatly appreciated.
Thank you, Helen. Yeah, good to see everyone.
Thanks, Helen. Thanks, Josh. Lear. Thanks, everyone.